Friends, I am Dr. Surjit Ghosh. Welcome to my channel, Dr. Ghosh Presents. Top 10 Homeopathic Remedies for Pharyngitis. What is pharyngitis? Simply speaking, inflammation of pharynx is called pharyngitis. Pharynx is a tube-like space that starts behind the nose, goes down the neck and ends at the top of the trachea and esophagus. Pharyngitis is also known as sore throat. Please note the picture on the right hand side. This is nose, this is tongue. Now from nose, this is nasal passage. Nasal passage, top of the nasal passage pharynx is started. This is called nasopharynx. From top of the back of the nose up to the level of tongue, this is nasopharynx. Then from tongue to the level of epiglottis is called oropharynx. Then from there up to the level of just esophagus is called laryngopharynx. So pharynx has got three parts: nasopharynx, oropharynx, laryngopharynx. What are the causes of pharyngitis? Viral infection, adenovirus, flu virus, mononucleosis, measles, chickenpox, corona, croup, various types of virus is the commonest cause. Actually, viral infection is the commonest cause. Bacterial infection, Streptococcus pyogenes. Other causes like abscess, allergy, irritants, dryness, GERD. This is gastroesophageal reflux disease, some sort of dyspepsia or acidity type disease, burning in the throat, one of common signs of GERD. Muscle strain, HIV, tumors also. Catching cold or drinking too much of warm liquid, and scrofulosis. Finally, scrofulosis is the term absolutely related to homeopathy. Scrofulosis means the person who has got hereditary dyscrasia of tuberculosis. This is pharynx. Obviously, it is oropharynx because you see just above the tongue, you see the portion oropharynx. Above it lies nasopharynx, below it lies laryngopharynx. What are symptoms of pharyngitis? Cough, sensation as if something stuck or clung in throat. Subjects, patients, try to throw it out by coughing but in vain. On inspection, to the help of a torchlight or say, throat is red, purple, swollen, visit mucus around, sago-like particles attached to it. Throat pain, scratchy sensation, hoarseness, difficulty in swallowing, talking, breathing and opening mouth. Swollen, red or pulsy tonsils, drooling means excess saliva secretion, fever, body aches, headache, runny nose, joint pain, nausea, vomiting, swelling, neck glands, lump in neck. There are so many symptoms, but lower symptoms are actually a bit chronic type. Symptoms of chronic type of pharyngitis. When to consult a physician or pharyngitis? For children, if difficulty of breathing or difficulty swallowing continues. Number 2, continuous drooling is there. Number 3, swelling of neck gland or any other symptoms go worse. For adult, if difficulty of breathing, swallowing, opening mouth continue, joint pain, earache, blood in flame, hoarseness continue, lump or swelling in neck noticed. These are the signs when a physician should be consulted for a adult subject. What are risk factors of pharyngitis? Risk factor means actually who are predisposed to being affected by pharyngitis. Age, children and teenagers. Persons suffering from allergies or scrofula, tobacco smokers or second-hand smokers, persons exposed to chemical irritants, persons having chronic or recurrent acute sinusitis, persons having weak immune system, place of dense gathering like public transport, classroom, office, etc. How to prevent pharyngitis? Since it is a mainly viral disease, so prevention of virus, the technique, those are all applicable here. Number 1, wash hands for at least 20 seconds with antimicrobial soap. Avoid sharing foods, utensils, clothing, towels, etc. Avoid touching face, nose, mouth, eyes with hand. Avoid close contact with people, touching public phone, etc. Use alcohol-based sanitizer in absence of water and soap. Disinfectant article of daily use like phone, keyboard, switch, remote, etc. periodically. Avoid exposure to cold. Scrofulous person should gargle with lotion made of glycerin 2 parts, rectified spirit 1 part, distilled water 8 parts, or saline water 1 gram percent twice a day to keep throat clean. Basically, but actually the saline water gargling is the best, because this lotion made of glycerin, rectified spirit, distilled water is very difficult thing to prepare for an ordinary person. Number 8, avoid all sorts of addictions and rich foods. Just simple picture is given. Please notice gargling and this addiction some statement. How to manage a case of pharyngitis? For acute case, restrict smoking, others addictions and solid foods. Food should be semi-solid, liquid, freshly prepared. If possible, get rest for a day or two. Gargle with saline water 1 gram percent thrice a day. Get remedial help if necessary. Actually, acute cases, if it is viral, then it is subside automatically. If you get 1 day rest, it will subside automatically. No medicine is required. There is no remedy will be required. But if it is bacterial infection or something else, then you may require remedy. For chronic diseases, chronic stress, meditation, relaxation, chatting, that is chronic stress must be controlled. Get regular exercise to strengthen immune system. Get regular vaccination against pneumonia, influenza related virus. Get yourself treated with homeopathic constitutional remedy for cure. For cure, you must be treated with homeopathic constitutional remedy. Close treatment with sulfur 1 mg 2 doses, 1 dose every morning for 2 consecutive days. If constitutional remedy chosen for treatment was not sulfur, that is constitutional remedy, say something else, your constitutional remedy was say argentum nitricum, but after treatment you must close the treatment with sulfur 1 mg 2 doses so that it doesn't recur. Sulfur stops recurrence of the disease. Some relevant pictures is given, just watch it. Now the remedies. Alumina for pharyngitis, throat dry, hoarseness, worse in the morning, inside throat dark purple, uvula enlarged, sensation as if something stuck in throat. Subjects try to cough it out but cannot do it. Phlegm gets hard after a lot of coughing. Accumulation of hard phlegm in throat. It is useful in acute as well as chronic cases. Argentum nitricum for pharyngitis for old throat ulcers in follicular pharyngitis. Sensation as if piece of wood stuck inside throat. Throat gets dried up when talking. Hoarseness with burning in throat. Hepatosal for pharyngitis. Pain in throat as if thorn pricked therein. During swallowing foods, the pains move up to the ears. Subject short-tempered, hypersensitive, sweat profusely day and night. The last symptom is the general symptom of the patient. It is not the symptom of the disease, but that is most important for selection of hepatosal. Sulfur for pharyngitis. Inside throat very dry, burning, therein with shooting pain. First left side affected, then trouble moves to the right side. Swelling of uvula, pain more during empty swallowing. Voice hoarse, low or gun. Worse in cold, damp weather. Calcarea carp for pharyngitis. Stitching pain on swallowing. Small ulcers spreading up to palate. Palate means the covering, arched covering over the tongue. Palate. Towards teeth it is hard palate, then towards throat it is soft palate. Uvula swollen edematous. Hawk up salty mucus. Subjects sensitive to cold catch cold easily. Cough with titillation in throat. They are dull, lethargic, like to sit idle. This is also general symptom related to the patient, not to the disease. Phytolocca for pharyngitis. One of the Top remedies for follicular pharyngitis: throat dark red, bluish red, puffy, white grey spots on fauces, painful soreness while swallowing, sensation as if a hot ball in throat, heart throbbing in right tonsil, quingy, cannot swallow anything hot. Tuberculinum for pharyngitis. Hawk up mucus after eating, enlarge adenoids or tonsils. When best selected remedy fails, history of tuberculosis in family, other parents, subject's symptom ever changing, losing weight fast despite eating well. Lycopodium for pharyngitis, sensation of something hard object in throat, as if a ball rises and stick in throat, sore throat worse from cold drinks, chronic enlargement, swelling and suppuration of tonsils. Trouble starts fast on right side, move to the left. Appropriate for chronic pharyngitis. Sorinum for pharyngitis. Hawks of foul cheesy masses. Recurrent quingy. Quingy means actually abscess or boils in tonsils. Sensation of a plug in throat which impedes hawking. Best selected remedy fails, chronic type. That is, this particular medicine used for chronic type of pharyngitis. Kali iode for pharyngitis. Chronic pharyngitis, while talking, swallowing, stinging and painful pressure, choking sensation as if something has lodged in throat. Better after hawking up a piece of thick mucus, boring and dirting pain in ears. With this, the video ends. Thanks for listening and viewing. If you got anything to say, please write down in the comment section. I will certainly respond.